All right, we'd like to thank you guys all for joining us today as we talk a little bit about our public health policy track for our DNP program. We're going to get started and do some introductions. So I'll start us off. My name is Jane Herman, and I am the recruitment and admissions coordinator for the DNP program. I work with our MSN students. I work with our public health policy students. So if you want to apply or have questions about the program after today's presentation, I'll be your main contact going forward. And then I'll introduce Dr. Tara Whitmire and pass it along.
Hi, I'm Tara Whitmire. I am the director of the DNP program here at Nebraska Methodist College. I'm also a nurse practitioner and have a casual practice once a week at Methodist Hospital, and it's very good to have you on with us. I'd like to also introduce Dr. Kylie Peter-Smith and let her tell us a little bit about herself.
Hi, everyone. I am Dr. Kylie Peter-Smith. I am the assistant professor for the public health policy program and core coordinator, and also am still casually practicing, working in community engagement at Nebraska Methodist College as well.
All right, thank you. Just some housekeeping, just so everyone is aware, we are recording this presentation. We like to have this to use at a later time. I can send it out. I'll actually send it out to everybody who has registered for the event, so you can watch this back if you have questions. Also, everyone is in listen-only mode and cameras are shut off, so feel free to participate and ask questions through the chat feature, and we will kind of save questions until the end, and then we can address anything that comes up throughout the presentation. I'm just going to start off by giving you some information about the college. We have over 40 areas of study here at Nebraska Methodist College. I think sometimes people are surprised to hear that. So we have everything from certificates through doctoral programs. Nursing is our biggest program on campus. We have everything from CNA, nursing, PTA, sonography, rad tech, all the way through all of the doctoral program. So lots of things to do here. We have been around for over 130 years. So we like to think we're pretty good at what we do here and have a lot of really great experience in educating our students. We'll talk about pricing later on in the presentation, but we do have very upfront pricing. So it's very easy to figure out exactly what everything's going to cost as far as fees and tuition and all that. So we'll kind of break that down later on in the presentation. We are affiliated with the Nebraska Health System, and besides that, we have over 85 community partnerships in the surrounding area. So our students have access to jobs and preceptorships and all kinds of things because of the many connections we have throughout the community. And then I'm going to pass it off to Dr. Whitmire to talk a little bit more about the program.
Thanks, Jane. So a little bit just overview of the DNP program, and we'll get a little bit deeper into some of these things on the next slide. But one thing I'm very proud of with our program is that all of our full and part-time faculty are engaged in practice. We have another nurse practitioner and a clinical nurse specialist who are active in their practice and continue to work casually in that role, as well as being educators. And I think that really just brings a wealth of information to our students and allows them to see from us what is happening, out in the real world in practice. And we all are doctorally prepared and have graduated from DNP programs in the past. Our public health policy track does allow for full-time or part-time plans of study, and we do admit in the fall and in the spring. So our plans are laid out accordingly based on the semester that you start, and are very doable for those that are still working full-time. We are an online program with a couple on-campus intensives, but we do have opportunity for synchronous learning, which we'll talk a little bit more about, where we all come together during each course in the semester, but then also coming to campus to do some hands-on things or just networking and getting to work with your classmates and your faculty a little bit more. So more about the program format. Our graduate studies are formatted in a 5-week block schedule. So we have class for 5 weeks. We get a week break, class for 5 weeks and get a week break. Our fall and spring semesters are 15 weeks, so we have 2 breaks in those terms, and then our summer is 10 weeks. Most of our classes are 10 or 15 weeks in length. We do have a few that are 5 weeks spread out throughout the program. And in those 10 and 15 week, or in those semesters, you may have some overlap. So depending if you're going full-time or part-time, full-time, you're usually taking about 3 classes a semester, but there is that overlap. So you're in all 3 of them potentially in that middle of 5 weeks, but then one of them ends and then you're in 2 for the remainder of the semester, or conversely, you might be in 2 in the beginning and 3 at the end. So our students really do like that 5-week block schedule where you get a week break. It means also that we don't follow the usual spring break or fall break that the campus follows. So that doesn't always matter to students, other than it can be a little confusing on our academic calendar. But just know that we have a break every 5 weeks, and that means that you can rest and catch up on laundry. Some people have gotten married. Somehow somebody's had a baby in that break time. So lots of things are possible. It just means we're not assigning work for you to do during that break. We also have collaborative interdisciplinary learning opportunities. So we have an educational doctorate program, as well as an MBA program, an MSN program, and there are some courses where all of those students are together in that course. And so it really allows for more rich discussion. You get to see viewpoints from those students who are working in a different field and can offer a different viewpoint. And so I think it really adds to your learning when you have other disciplines in those courses with you. As I kind of mentioned, we do have synchronous learning opportunities. So we do use Microsoft Teams as our online platform. And most of the time we're meeting at the beginning of a course to go over the syllabus and talk about course expectations. Other times you might be coming on to do test reviews. We might be doing some online quizzing, or just going over course material, depending on what the course is. There may be opportunities for you to do a presentation to your classmates, and some faculty also just use it as office hour opportunities. So if there's a project going on or a big paper, they're just available for you to come onto the Teams and ask your questions, and then go about your evening. So those are scheduled ahead of time. We do send that schedule out a few months in advance so that you can plan accordingly. Those synchronous times aren't, they're highly encouraged that you attend, and we do record them in case you can't attend. And it's important that you watch that information just so you can stay up to date with what's happening in the course. And it usually occurs in the evening. We schedule them from 5 to 8:30 Central Standard Time. And so hopefully you're home from work and able to log on and connect with your classmates and your faculty. And then we do have 2 times that the public health policy students come to campus. The first is for program orientation, and that is usually the weekend before the fall or the spring semester starts, depending on when you're starting. And it's just an opportunity for us as a college and a program to showcase all of our resources, what we have available for you, networking with faculty and staff and your fellow classmates, and also just talking more about the program, more about the degree and the role, and really just helping you be prepared to start in your doctoral program. And then the second time you come is for the population health summer intensive, and that's an opportunity to learn from community partners and just talk more about population health topics that are relevant to all aspects of nursing, and again, just an opportunity to network and kind of engage with faculty and your fellow classmates. Next slide.
Not advancing. There we go. Sorry.
All right. So this program is really designed to help students develop both the experience and the leadership skills needed to drive the meaningful change. So I think it's important, people hear the term public health policy and they immediately think politics. And so while politics does play an important role, public health policy is so much more. And so we're really looking at, throughout this program, the things that shape our lived experiences, our community's lived experiences, what shapes the communities that we reside in, and our access to resources. So how can we as leaders really positively influence the health and well-being of our community through our health systems and through the communities, and how can we do so upstream? So that's really done through the promotion of good policies and looking at where people live, work, play, pray, and learn. And so we look at disparities in terms of social determinants of health, like housing and education and income, and how does that impact our communities? This program emphasizes community-based research and real-world application. It's one of my favorite things about the program. Students would gain skills in terms of how to identify health risks and emerging issues in public health, how to develop policies and programs that are aimed at improving public health. So things like vaccine programs or nutrition initiatives or environmental regulations. How do we develop those skills to influence those things? You gain experience working collaboratively with government agencies or healthcare providers or even nonprofit organizations within the community on how to positively implement policies. Then you also would develop skills, advocacy skills, to help influence policy at an organizational level, but also within the community locally at a state level or nationally. So all of this knowledge then, as you go through the program, would culminate into this doctoral scholarly project. And this project allows you to address an important health issue while also having that tangible impact on your community. In terms of public health policy professionals, what does that career look like? Where could you see yourself, or where do students typically go when they graduate? This is another thing I really like about the program, is that this degree can put you in a variety of places. Places like government agencies, health departments, the Centers for Disease Control. It can put you in nonprofit organizations or advocacy groups that are focused on public health initiatives. Within healthcare systems, especially in leadership in healthcare systems, we need policy analysts to help navigate very complex regulations or to develop policies that can improve patient care. It can put you at colleges or universities and research institutions within pharmaceutical companies or accountable care organizations. So it's a broad career path that is very impactful. And in terms of the practicum format, we really want to prepare students for those future roles. And so the practicum is set up, you would have 100 hours of practicum credited from master's degree, and then you would have 960 practicum hours that would be completed through guided experiences as well as that doctoral scholarly project. So for this degree, you would have a public health practicum, a healthcare policy practicum, a residency, and the doctoral scholarly project. And we do have a unique setup for this as well. The practicum experience is really individualized to the student, and it's guided by course faculty. So course faculty often serve as the preceptor for these experiences, and course faculty or myself would work individually with the students to identify how would the hours be obtained for those certain practicum hours. And that's based on a variety of things, sometimes future career goals, passions, as well as our course and program outcomes. It's typically set up to where you would do, sorry, I'm still on previous slide, 1 to 8 hour clinical days per week. And you can get direct hours for these experiences by, again, working with government agencies, with legislative offices, think tanks, nonprofit organizations. So you can get direct hours there, but you can also do some hours, especially for the healthcare policy practicum, doing things like researching current legislative bills or current legislation that is upcoming, conducting research reviews on how do those bills then impact the health of a population, working with senators or lobbyists to learn more about those bills. You can attend hearings, make public comments, also working with community nonprofits to help roll out awareness campaigns. So again, a variety of ways that we try to bring in those skills and make this real world application for you. And then in terms of the doctoral scholarly project, again, this is a project where you would identify a need, a gap, or some sort of problem within the community, and then you would implement a problem or a solution. And so this might be something that you would see within your current job, within your kids' school, or within your community, that then you could address with a new policy or program. Next slide.
Okay, we'll talk a little bit about admissions criteria. So for this program, you need to have a BSN in nursing from an accredited program, and then a master's degree in nursing, public health, or some related field similar to that from an accredited program. The GPA requirement is 3.0 or higher on a 4-point scale in your most recent degree program. You do need to have a registered license in place at the time of application. We don't require practice as an RN. It's encouraged but not required to have that practice. And then fulfillment of technical standards, that is just simple questions on the application as far as, can you lift? Do you understand the parameters of the profession? Can you get yourself to and from places? Things like that. Very simple, just yes and no questions. And then we do have to make sure that we meet state authorization guidelines, because this is an online program. We have to meet different standards for each state. So as you apply, I always look to see where you're from and verify that we are able to provide distance learning in the state in which you live. For the application, it's a simple online application. You'll go to our website and fill out the application itself. You'll attach a copy of your resume or CV, and then there is also a written statement, an application essay. For that essay, my advice is be sure to answer the writing prompts. We give a few writing prompts and want you to respond specifically to those prompts. Once in a while, we'll get personal statements rather than somebody replying to those prompts. So that's my advice for a good applicant. We do need official transcripts from wherever you graduated. So those do need to be sent directly from your college. And then a copy of your license, which honestly, a lot of times I can just go on and pull that for you. So that's not necessary that you track it down. I can do that. And then once we review your application, and if you should be qualified, you'll be invited to an interview with our faculty. And that's usually done over the phone with 2 faculty members. They have a set of questions they ask. They spend a great deal of time kind of talking about the program, a lot of actually what we're including today, just to make sure that you have a good understanding of everything. And then they also leave plenty of time for you to get your questions answered as well. We do accept on a rolling basis too. So the sooner you apply, the sooner you know. We will take applications for this coming fall all the way till July. I don't recommend waiting that long. However, if you could apply in May or June, that really just sets you up for success and lets the whole onboarding process not be too rushed. And then there's plans that you'll need to make to come to that in-person orientation on August 16th and 17th. And so if you could get your application in May or June, that would really just benefit you. And then for spring, we do have that spring start too, which starts in January on the 12th. And so for that, I would really recommend applying, in October or November. Just December gets a little crazy. You'll find out that colleges are closed. So getting transcripts sent, things like that can get a little dicey. So the sooner you can apply, the better. And then as we see completed applications come through, we get them reviewed right away. And usually students know, within a week of having an interview, whether or not they've been accepted. So we can do the process pretty quickly. as long as we have all the materials from you that we need. Here's just a quick outline of costs for the program. So this is for our 25-26 academic year. Cost per credit hour is $850. There is an enrollment deposit. After acceptance, we do ask for that deposit. That just lets us know that you're coming, secures your seat in the program, and then kind of lets other departments across campus know that you're coming and kind of triggers next steps to start happening as far as meeting with your advisor and things like that. That enrollment deposit is credited towards your student bill. And then there are some fees. We keep those minimal. We don't charge fees per credit hour, so it's pretty simple to figure out what you're going to owe each semester. We think this is a much more transparent way to do it. The biggest one would be the technology fee that we charge every fall, spring, and summer semester. And then there's a few fees that just happen, one-time fees throughout for the program. As far as financial aid, you're welcome to fill out the FAFSA. You're welcome to bring in any external scholarships that you find. We do have the NFLP, the Nurse Faculty Loan Program. What that is, in quick summary, is it's a loan forgiveness program that's set up to forgive loans for students who want to go into education. So if becoming faculty is something that you see yourself doing, that program would be right for you. Essentially, it can forgive up to 85% of your loans in return for teaching at an accredited institution. A few of the other things we have available, the NMC Legacy Grant. So that's a one-time award of $2,000 for anyone who graduated from NMC and is coming back to us. And then I just like to point out that you should definitely check in with your employer. There's oftentimes money that is set aside for continuing education. So make sure you do your research and find out if there's anything that you could take advantage of. Also check with any professional organizations that you belong to. There's often scholarship money there. And then we do have community partners that we have a discount for. So for example, Nebraska Methodist Hospital, all the clinics, the whole system has a 20% discount for their employees. As well as Children's and some other places around the community. So those are all listed on our website. We do continue to add those corporate partners. So check back to see if your employer is part of that. And then that discount can be also used for spouses and eligible children. So if you have questions about any of those things, I can definitely walk you through that or see if something might be a good fit. I can send out information too specifically about that NFLP opportunity. I have some nice handouts on that I could share as well. And then from here, there are some commonly asked questions that we get over and over. So we just thought we would kind of address those. And at this time, if there are any questions that anybody has, you're welcome to add those to the chat box and we can address those as well.
Great. So the first one is, you're working full-time. Can you complete a program like this? And the short answer is yes. The long answer is yes. And it's totally up to you how fast or how slow you do the program. So we do have the full-time track, which is about 2 years, and the part-time, which is about 2.5 years. And so I always recommend to students that they kind of take an inventory of their time and see what are some things that maybe can take a pause as you switch your focus to your education, and being okay with saying no sometimes to different things so that you can protect that time and space in order to get your studying done and get the most out of the program. So I know many times students are working full-time as nurses, and that's a necessity because we need to pay bills and have food and, take care of our house and everything. And they're working. And so we frequently know that we're kind of third or fourth on the list of priorities and time commitments, but it's really important that we stay there so that you can stay focused and really give the time you need to learn this new role and get the full benefit of the education that you're receiving for it. Dr. Peter Smith, do you want to give an example of yourself potentially when you were going through the program and kind of the time you spent working and working in the program?
Yeah, so I did work full-time going through the program. I think that's one of the benefits of the program is that some of the learning is asynchronous on your own time. So I worked full-time and actually had a baby during the program. And I think one of the benefits of the program too is the real-world application. So it didn't feel like school so much to me. It felt more like I was learning about what I was doing in my career and applying it right away, and had some flexibility in terms of when I could do my schoolwork, know well in advance when the assignments are due. And so nights, weekends, I just kind of flexed my schedule around that to where I could still work and raise a small baby. And then there was flexibility too in the practicum hours quite a bit. So I enjoyed that.
Great, thank you. The next one is, will you take transfer credit? And yes, we do. We take up to 12 credits of transfer credit. We do have a process that we would ask you to go through to submit your transcripts and to submit syllabi for relevant courses that you feel might meet the standard or meet the requirement of courses that we offer. So if you have taken some classes within the last 5 years or so that you think are applicable, then we would direct you to that transfer credit process. When you meet with our advisor, she usually tells you how to get that done and sends you the information. The next one, how much time per week will I need to commit? So kind of along the line of working full time, it's good to know what is required for you, like course time wise. So kind of the rule of thumb is that it's 3 hours per week per 1 credit of class. Keeping in mind that you might be taking 2 or 3 classes, so it's important to know that you're going to have to spend about 135 hours for a 15-week class in a semester. And knowing that if you're taking a 2-credit class, it could be 90 hours that you're spending over the course of the whole semester. So again, 3 hours a week per credit is kind of the recommendation. I also like to say that it's not just time spent reading and studying, but it's time processing it. It's time, applying it to what you're doing. As Dr. Peter Smith said, it's time that you're folding laundry and you're contemplating what's happening in the world or what you read about and how you can apply that to your own learning and how that learning is changing you. So education should change how you think, how you react, how you feel, all those things. And so I often like to call it rocking chair time or like windshield time if you're driving and listening to things, or you're just stuck in traffic thinking. Like that all counts towards that 3 hours a week per credit per semester type thing. So don't feel like I have to spend all this time in front of books and doing these things, but it's definitely just pondering and contemplating and applying as well. Dr. Peter Smith, can you give us some examples of what some students have done in the past for their doctoral scholarly project and how it applies to the public health policy track?
Yeah. So again, this is identifying a need within the community or within your organization. So we've had students from a variety of different backgrounds and areas across the nation. So a couple that really stand out to me, we had one student who actually lived in Washington State who developed a faith-based education program in an African church with the goal of increasing early testing and care coordination for community individuals that have HIV/AIDS. And really what the goal with that was to also reduce the stigma associated with HIV/AIDS. We've had students who have worked to address food insecurity in one was actually here locally, and that was a program that was developed, an educational program with a local pantry to help increase the amount of donations that were coming to that pantry. I myself went through this program, so I reached out, or had a shelter actually reach out to me that had recognized a gap in their children getting access to healthcare. My background was a pediatric nurse, so when they reached out and said our children aren't getting the recommended screenings at the time that they need it, that was something that appealed to me. And so I worked with this local shelter to implement a program where we were bringing developmental milestone screenings, as well as hearing, vision, all of the routine wellness screenings to the children within the shelter themselves, and then working with them to develop care coordination to get them follow-up care as well. We've had students who've worked to address maternal mortality rates, or develop birth programs to help improve birth outcomes. Just a variety of things, all very important.
Mm-hmm. Great, thanks. A little bit more about the Doctoral Scholarly Project courses. So it's a series of 4 different courses that usually start, they start in the summer. So depending on what your plan of study is, it could be the summer before you graduate, or a year ahead of that. But in the first course, sorry, I misspoke. So you're taking DSP-1, which is identifying what the issue is and what your intervention is going to be, and doing literature review about what is out there already, what the available knowledge is, and kind of looking to see how it could be applicable to the issue that you're trying to solve. So we're not trying to solve all the world's problems with this one project. It's really taking a little piece of something that you can do within that community or that specific location. And hopefully it's something that is able to continue on after you're done with your project. So it's a sustainable effort that continues to make a difference. So DSP-1, identifying the issue, what your intervention is going to be, looking at the available literature. And then you move into inquiry for the DNP. So it's sort of a self-paced courses that you're matched with a faculty who works with you through the entire process. You're taking 9 credits total around this doctoral scholarly process project. And so you kind of decide each semester how many credits you want to take, and that equates to the work that you're putting in. And so we have a template and a process that is easily followed, and we have lots of synchronous classes in the beginning to help students kind of work through writing that proposal and identifying your population and your intervention and how you're going to measure it and who's helping you implement it. You should have a clinical partner, or a community partner that is kind of the champion for wherever you're doing this at, and helps you with anything that needs to happen at that location. You do go through the institution review board, and they give approval if it's a quality improvement, or if it's if it is research, they'll give the appropriate approval that way, and then you'll work to actually implement it. So in Dr. Peter-Smith's case, she got the screenings done and got the relevant people there to do those sorts of things. So you actually do it for a time. Usually it's the spring semester that you're implementing and gathering your data, and then you analyze the data. Did what you do make an impact, and then work towards disseminating it. So we ask that you put together either a podium presentation or a poster presentation, write a manuscript for publication, getting something like that ready. And we do encourage you to disseminate it to, for sure, the place that you did your project at, but then also think about where else this information would be helpful. We do have research day here at Nebraska Methodist College, and we've actually moved it to just a few days before graduation, usually in the summertime, so that students can come present their work at that avenue, and then go on to having commencement. And so you can think about journals that are relevant to public health, or the on the National Public Health Association or whatever your topic is, thinking about where you can disseminate your findings and hope to continue to make an impact in that way. So again, it's one DSP1 course, and then you move into that clinical inquiry, working one-on-one with faculty through the whole process. One other thing is what support services are available. I'm really proud to say that at Nebraska Methodist College, we do have a writing coach and a statistician on staff. So they are available to all of our graduate students, no matter what program they're in. The writing coach is very helpful with grammar, sentence structure. If it's been a while since you've written, then she can be very helpful to kind of get you back on track. Our library and librarians are very good about helping with APA format as well. There's requests that you make online to ask for that assistance. And then our statistician is available to meet with you as you're writing your proposal and helping to kind of understand what statistics you'll need to do and how you're going to set all that up. And then he can help kind of run the data, or, tell you how to do it and help with describing it and making sure that you've got everything correct so that you are able to really showcase the work that you did. So I know I see places, our students online all the time asking for help with editors or statistics. And so I think we are proud that we have those available to you, included in the program. We also have lots of just wellness support and psychological support. So we have a program called You Will that is an online counseling resource, and it can be used anywhere in the country. It doesn't matter where you're at. You can log in, request to meet with a counselor about a variety of topics, and can find somebody in person, or it can be done virtually, no matter where you're at. They also offer a lot of coaching services. So if you need help with your resume, or you need help with public speaking, or any sort of thing, there's coaching available through that program as well. I think our other really valuable resource is Katie Meintz, our graduate advisor. She is a wonderful person. She has good ears that are good for listening, and she can point you in the right direction for any resources, but also she just genuinely cares about you and likes to get to know everybody, and things that are needed or support that we can offer. She is your go-to person for that, and we're very fortunate to have her on our staff.
Okay, great. I don't see any, additional questions that have come through. If anybody has any, we can address those. If not, your next steps would be to contact me. I will be the one that works with you throughout the application process, interview process, all of that. So if you have questions that you come up with later, feel free to reach out to me. My contact information is here. If I don't have the answers, I have these ladies who are always welcome to field questions and visit with potential students as well. So we are just here to support you in your decision and be with you along the way as you research the possibility of coming to Nebraska Methodist College. So we thank you all for coming, and please reach out if we can help in any way. Thanks for attending today.